This amendment is intended to bring the bill in line with one of President Obama's pledges to the American people. I think that virtually everybody in America has probably heard President Obama describe the parameters of the health care proposal that he seeks to have Congress adopt. And one of the core points that he has continuously made is that he will not impose a new tax on those in this country individuals making less than $200,000 a year or families making less than $250,000 a year. For example, in August of last year in Orlando, Florida, the President said, and if you're a family making less than $250,000 a year, my plan won't raise your taxes 1 penny. Not your income taxes, not your payroll taxes, not your capital gains taxes, not any of your taxes. Similarly, in September of last year, in New Mexico, the President said, you will not see any of your taxes increase 1 single dime. And if you make less than $250,000, if you make less than $250,000 a year, you will not see any of your taxes increase 1 single dime. And just one other quote that the President made among many that he's commented on this. Again, last year in September in New Hampshire, the President said no family making less than $250,000 will see their taxes increase. And I can make a firm pledge under my plan that no family making less than $250,000 will see their taxes increase. And again, he said, not your income taxes, not your payroll taxes, not your capital gains taxes, not any of your taxes. Well, as we have already discussed previously, this legislation, the conceptual paper in front of us, does propose tax increases that people who earn well less than $250,000 will be paying. And the purpose of this amendment, the amendment's very simple. It simply provides that no tax, no fee or penalty imposed by this legislation shall be applied to any individual earning less than $200,000 per year or any couple earning less than $250,000 per year. Let me identify just briefly what taxes I've identified in the bill that I think this amendment would apply to. In one of the amendments I brought earlier, Mr. Chairman, you will recall that I made a very strong argument that the pay-or-play provisions in the bill, the proposals that employers who do not provide health insurance to their employees have to pay a penalty, would be directly passed on to their employees, who would then pay higher taxes or higher fees because of those taxes. I'm not counting that as a direct tax. I actually believe that should count, and I believe that those kinds of direct pass-through costs that we are passing through to employees of small businesses or of any businesses who don't provide support to their health insurance to their employees should be counted. But just looking at the direct tax increases in the bill, first, the individual mandate to have health insurance under this bill would impose an excise tax of $750 per person, up to a maximum of $1,500 per family, for anyone between 100% and 300% of the poverty level. For those above 300% of the poverty level, the tax would be $950 for individuals and up to $1,900 per family. An analysis of this done by the Joint Tax Committee and CBO has shown some rather remarkable statistics. The JCT and CBO numbers show that of the estimated $2.8 billion that this tax will collect in 2016, 71% would come from people earning less than 500% of poverty. That's $120,000, not $250,000. 71% of this tax will fall on people making less than $120,000. In fact, $600 million of it will fall on those making between $24,000 and $48,000 a year. Another $600 million of it will fall on those making between $48,000 and $72,000 per year. Another $500 million of it will fall on those making between $72,000 and $96,000 per year. and another $300 million will fall on those making between $96,000 and $120,000 a year, for 71% of that tax that will be imposed falling on those making less than $120,000 per year. We don't have statistics between $120,000 and $250,000, but of the remaining $800 million collected, we can assume, I think safely, that a significant amount of that would be paid by people making less than $250,000 per year. Another direct tax increase in the bill is the provision in the bill that increases the penalty from 10% to 20% for anyone who uses a portion of their health savings account for purposes other than qualified medical expenses. In these difficult times, many middle-income families may unfortunately need to dip into their health savings accounts to address unexpected financial difficulties. Doubling the penalty for doing so for these families is an unnecessary and an unwise tax increase on those families. And then finally, in the Chairman's modification, the floor on deductions for medical expenses is raised to 10% from its current level of 7.5%. The current law tax provision allows several million Americans with very high health care costs to deduct from their income, and thereby lowering their income taxes, some of the costs for their medical goods and services that are not covered by insurance. And I know that I don't think that there's any way that this cannot be acknowledged as a direct tax increase on those who now will lose that additional portion of their deduction for these medical costs. Again, according to the Joint Tax Committee, which provided a distributional analysis of this provision, the bulk of this $21 billion tax increase will fall on those who President Obama promised to protect. In 2017 alone, in 1 year alone, this provision will raise $13.8 million on tax units, meaning single filers and families. It will raise taxes on 13.8 million tax units, that's singles and families, by $3.73 billion. Of those 13.8 million taxpayers, or tax units, because some are families, only 86,000 of them will have an income above $200,000. And what that means is that this particular tax increase in the bill, $3.73 billion in 1 year, and who knows how many if we accumulated it over 10 years, of this particular tax increase, 99.6% of it hits affected taxpayers who have incomes less than $200,000. These are just three of the more prominent tax increases in the measure that would place an undue burden on our middle class and violate President Obama's commitment that this health bill will not increase taxes of any kind. His words were of any kind, will not increase taxes of any kind on those earning as singles less than $200,000 or families less than $250,000. I urge my colleagues to support this amendment. Again, it's very simple. It will remove all taxes, fees, and penalties from the bill that apply to families earning less than $250,000 per year.
Further discussion? Well, first, we don't have a quorum.